Sleep deprivation or sleep disturbances, which typically may occur because of sleep fragmentation, because of sleep apnea, or maybe inability to get enough sleep because of insomnia or other sleep disorders. Shorter term, they would have a lot of neurocognitive impact, which means that would disrupt their work-life balance. They won't feel very creative and productive to go back to their work. Hi, I'm Dr. Sibasish. I lead the clinical team in ResMed. And every day at ResMed, we see a lot of patients who are suffering from sleep related issues and technically what we call as sleep disorder. So I think today we are going to discuss a few important aspects of how sleep deprivation or disturbances can lead to a lot of health issues in anyone's life, right? So if we look at sleep deprivation or sleep disturbances, which typically may occur because of sleep fragmentation, because of sleep apnea, or maybe inability to get enough sleep because of insomnia or other sleep disorders, right? So whatever may be the case, but there are both short term and long term consequences of these particular disorders like sleep apnea. So for example, if someone is having sleep apnea, there is sleep fragmentation which happens during the night, and there are issues with the quality of sleep. So in shorter term, they would have a lot of neurocognitive impact, which means that would disrupt their work-life balance. They won't feel very creative and productive to go back to their work, or not. There would be a lot of issues even with their family life, with dealing complex situation in their particular life. Along with that, if you look at long term consequences, there are various cardiac and metabolic consequences, like these people are more prone to develop type 2 diabetes, cardiac related issues like heart failure, irregular heartbeat, and so on and so forth. So I mean, when we look at all these consequences of disturbed sleep, it is very imperative to think how can we make our sleep better. So if we look at the various data points, ResMed has been conducting sleep surveys for quite some time right now, and what we found that almost 42% of the individuals whom were respondents to the survey this year had some amount of sleep disturbances, and they found that it is mainly because of work related stress, right? The other piece is what we also found, that almost 90% of these individuals in the survey were well aware that that if they sleep better, then they are going to be more productive at work, they are going to be have more successful in their family life, and so on and so forth. So a general awareness is definitely there among the community that sleep health is very important, and sleep health also impacts their day to day lifestyle, right? So let us also understand that how we can make our sleep better, how we can optimize our sleep health, right? So number one point is, of course, that whenever you are preparing to go to sleep, at least for within the 3 hours of sleep, when you are trying to go to bed, please don't take any caffeine, alcohol, and also complete your meals at least 3 hours before you are planning to go to bed. Also when you are planning, it might so happen that you can dim your lights, you can reduce the noise around your surroundings. Of course, you can listen to some soothing music, you can do some meditative exercise that would help you, right? You can also modulate the room temperature to somewhere around 24 to 26 degrees Celsius, because that is the temperature where our body is more comfortable. Okay. The other piece is that try to maintain a daily routine of your sleep. So particularly if you are going to bed at around 10:30 at night, try to maintain that. Okay. And then if you are waking up at maybe 6 or 6:30 in the morning, try to follow that particular routine. So that would actually help the body to have its I would say align itself better to the circadian rhythm, right? And that becomes a habit in the long term. The other piece is, which I always advise, is that write down your worries and anxieties. That kind of reduces the load on your system, reduces the stress and anxiety which you are suffering from. And lastly, I'd like to reiterate that if you feel that you're not getting proper sleep, or if you feel that you have some kind of sleep disorder, it is better to consult a sleep specialist, or maybe the physician whom you are comfortable with, right, and who can kind of guide you. So I think with these tips, I'm pretty sure that you'd be able to get better sleep and should be able to make your sleep health better, right. So signing off for now. Thank you so much.